Today's quick coding tip focuses on how to code a central line associated infection. My name is Claire and I'm an inpatient coding auditor. In my coding tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. A central line associated infection is an infection that occurs as a result of a patient having a central line. A central line is an intravascular catheter used for various purposes such as infusion, withdrawal of fluids, or hemodynamic monitoring. The tip of a central line is positioned either near the heart or within one of the great vessels. Examples of central venous catheters include the Hickman catheter, peripherally inserted central catheter, otherwise referred to as a PIC, portacath, umbilical venous catheter, triple lumen catheter, and pulmonary artery catheter, also known as a Swan-Ganz catheter or a right heart catheter. When coding a central line associated infection, coders should carefully review the medical record to ensure that the type of catheter causing the infection is in fact a central line rather than a peripheral line, and if necessary, query the provider as this does affect the code assignment. Before assigning a code for a central line associated infection, it's very important to ensure that the healthcare provider has clearly documented a cause and effect relationship between the central line and the infection. Terms such as due to central venous catheter, catheter related, and central line associated indicate this relationship. If this link is not made or there is conflicting documentation, a query is necessary to clarify the cause and effect relationship. There are two major categories of infections due to central venous catheters in ICD-10, systemic and local. Systemic infections include sepsis, bacteremia, and bloodstream infections due to central venous catheters. These infections are commonly referred to as central line associated bloodstream infection or catheter-related bloodstream infection, often abbreviated as Clab-C. T80.212 bloodstream infection due to central venous catheter is assigned for a systemic bloodstream infection due to the central line. In order to assign this code, you must have clear documentation that the central line associated infection is a systemic bloodstream infection. A local infection is very different from a systemic bloodstream infection. A localized infection specifically refers to an infection occurring at the exit or insertion site of the catheter, a port or reservoir infection, or a tunnel infection in the case of a tunneled central line. T80.212 Local infection due to central venous catheter is assigned for a localized infection due to a central line. When assigning and sequencing codes for a central line-related infection, it's important to follow the official coding guidelines. The first code to be assigned should indicate the appropriate category T802 code for the central line-associated infection, followed by an additional code that identifies the specific type of infection such as sepsis or cellulitis. This sequencing is directed by the guidelines and the instructional note provided at category T802, which instructs coders to assign an additional code to identify the specific infection. Let's take a look at a couple of examples, starting with a systemic infection caused by central venous catheter. This patient has been diagnosed with bacteremia due to central line associated bloodstream infection, otherwise known as a Clab-C. This diagnosis definitively establishes a link between the bacteremia and the central venous catheter. So our first step is to assign the code for the systemic bloodstream infection, followed by the code for the bacteremia. To begin looking up our code, we start in the alphabetic index under the main term infection and find the subterm due to or resulting from. Then we go to central venous catheter and finally to bloodstream, which leads us to code T80211. Next, we confirm this code in the tabular and review any instructional notes. Here we find that central line associated bloodstream infection is an inclusion term for this code, confirming that we have arrived at the correct code assignment. Additionally, we see that there is an instructional note directing us to use an additional code to identify the specific infection, and so we assign the code for bacteremia as a secondary code. In this next example, the patient has been diagnosed with streptococcal group B sepsis as a result of a central venous catheter used for hemodialysis. The diagnosis clearly establishes a cause and effect relationship between the sepsis and the central venous catheter. So our first step is to assign the code for the systemic bloodstream infection, followed by the code for the sepsis. To begin looking up our code, we start in the alphabetic index under the main term infection and find the subterm due to or resulting from. Then we go to device, implant, or graft, then to catheter NEC, then to dialysis, and finally to central line, which leads us to code T80.212. It's important to note that although this is a hemodialysis catheter, it has been specifically identified as a central venous catheter. As a result, as you can see by the indexing, it should be coded to T80.211 for bloodstream infection due to central venous catheter, rather than being coded under T827 for. This is because code assignment is based on the location of the catheter as a central venous catheter rather than its function for hemodialysis. Now let's look at some examples of a local infection caused by central venous catheters. This patient has been diagnosed with cellulitis due to a peripherally inserted central catheter, otherwise known as a PIC, at the insertion site on the left upper arm. The diagnosis definitively establishes a direct link between the cellulitis and the PIC line. So our first step is to assign the code for the local infection due to the central venous catheter, followed by the code for the cellulitis. To begin looking up our code, we start in the alphabetic index under the main term infection and find the subterm due to or resulting from. Then we go to peripherally inserted central catheter, and finally to localized, which leads us to code T80.212. Next, we confirm this code in the tabular and review any instructional notes. We find that exit or insertion site infection and local infection caused by a peripherally inserted central catheter are both inclusion terms for this code, confirming that we have selected the correct code. Additionally, we see that there is an instructional note directing us to use an additional code to identify the specific infection, and so we assign the code for cellulitis of the left upper arm as a secondary code. In this last example, the patient with a tunneled central venous catheter has been diagnosed with a tunnel infection. This diagnosis definitively confirms that the infection is located within the tunnel of a central venous catheter, so we will assign the code for the local infection caused by the central venous catheter. Since the specific type of infection was not specified beyond being a tunnel infection, we will only assign one code. To find the correct code, we start in the alphabetic index under the main term infection and find the subterm tunnel, which directs us to code T80.212. Next, we confirm this code assignment in the tabular and find that tunnel infection is listed as an inclusion term for this code, validating our code assignment. Additionally, we see that there is an instructional note directing us to use an additional code to identify the specific infection, but since the diagnostic statement does not provide further details on the type of infection, we will only assign the one code for the local infection due to the central venous catheter. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up, and if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding!